So if you've noticed your gums look a little different than they used to, if a tooth feels a little loose when it didn't before, or if you have been secretly avoiding apples, corn on the cob, or anything that's too chewy, then you're about to learn something that will change the way you think about your teeth for years to come. In my years with patients age 55 and older, I've witnessed this same sequence over and over. It's not about being old, getting old. It's just about some small, specific, correctable issues that you're not even warned about. One of them I'm going to cover later in this video that really surprises my patients the most. Hold on to this one. It could prevent you from losing teeth that you don't need to lose. Hi, just a quick word of introduction. I'm Dr. Alex Mandell. The things I've learned in my career is to help people get healthy as they age, not by using fear, but by providing them with clear and honest information that they can use in their daily lives. There's one thing that I want you to understand the first time you read it. You can have teeth loss after 50, but it's not a fact of life, not a matter of bad luck or bad genes. In nearly all cases that I have encountered, there were warning signs months, if not years prior to the loss of a tooth. The trouble is, those red flags are tiny and seemingly insignificant to people. I'm going to explain exactly why this is, how it gets accelerated by everyday habits, the very surprising links with other parts of your health that no one mentions, and importantly, what little steps you can start this week that will help to protect the teeth that you still have. I'm going to go over the one thing that in my experience is the thing that causes most tooth loss after the age of 50, and it's something that most people have never even heard of. Let's get into it. The gums are the first place that it usually begins, not the teeth, but the gums. I recall a patient who I'll call Linda, a retired school teacher age 68. She was brought in because she noticed some blood when brushing. Just a little. She thought she must have rubbed the brush too hard the morning. This time, no pain, no big symptoms. She was about to say nothing about it to me. The little bit of bleeding was really the tip of the iceberg, what is actually being called periodontal disease, or chronic inflammation of the gum tissue due to bacterial formation along the gum line. This inflammation over time erodes the bone and other tissues that anchor your teeth to your gums. Here's the basic one, and that's pretty much all the science you need to know. It's not the disease itself that's a problem, it's the fact that it doesn't make noise. Gum disease doesn't cause pain until it is serious. When a tooth is loose, the bone that supports it has already been damaged for years of time. But the story of Linda can be ended in a hope-filled way, which I will come on to later. Here, I want you to observe this, as I see it over and over again with patients, that the body does not normally say, "Oh, there is something wrong in the mouth." It whispers, some slight pink discoloration in the sink, some sensitivity while flossing, a slight recession of the gum that makes a tooth just a little longer than it is. People rationalize these things out. One of my patients, Robert, 70, explained that he had always thought that his gums just looked like this. One patient, Robert, 70, said he could only imagine his gums looked like that 15 years ago when his daughter pulled out an old picture of him. It had become so subtle that he truly would not have known that it was occurring to him. That's why I'm pushing you to get it with the whisper and not the shout. The mild gum disease known as gingivitis can be corrected by proper cleaning and care. You can stop the disease from worsening once it becomes periodontal disease, though the bone and tissue lost will not regenerate without intervention. This is the line to take note of before crossing. So why did I get surprised when I began to pay a closer attention to my patients' charts over the years and realized that gum disease was not alone? There was something else which was recurring in the same patients, and it was not related to their brushing abilities. Most of my patients are taken aback when I tell them this one. It's something they take daily, but which works against their teeth in the background. A patient, David, 74, sharp as a tack, took care of himself and walked every morning, eating well. However, his teeth began to decay much more rapidly than they ever had before, at the gum line, in places where he never had issues before, and he came to me concerned. As we read through his list of medications, it was immediately clear that he was on a blood pressure medication and an anti-allergic medication, both of which were common and both of which were very effective in treating their ailments. Many medications seniors use on a regular basis for their blood pressure, depression, allergies, and even some pain medications cause dry mouth or a decrease in saliva production as a side effect. Saliva is for more than comfort. It removes food particles, balances out the acid, and repairs pre-loss of tooth naturally. Without the protection of saliva, the mouth is more vulnerable to decay, which can accelerate more quickly than most realize, particularly at the gum line where receding gums have exposed more of the tooth surface area. The antics to be done here are pretty simple, but almost no one does. If you are taking a drug that dries your mouth out, tell your dentist. Small changes like drinking water throughout the day, a sugar-free lozenge, or a fluoride rinse before bed can help. David changed one thing. He added a fluoride rinse before sleeping at night, and when he returned to the dentist office at his next appointment, they found that the new cavity hadn't advanced much. I'm going to stop here because I believe this is one of the most frequent blind spots I'm running across in this age group. When they're in their 60s, many of my patients already take 3, 4, 6, or more pills a day for blood pressure, cholesterol, and joint pain. No one tells them, bye-bye, here are a few of these dryers that are actually chasing decay right down there. It's just that you don't know it. It's not that your cardiologist is only interested in your heart. Your dentist may not see the whole list of your medications, and you're just trying to keep track. I recall a 72-year-old patient who told me that she began carrying hard candy in her purse because her mouth was dry all day, every day. She felt that she had only been thirsty. In reality, what she was actually doing, without knowing, was bathing her teeth in sugar during the day on top of an already underprotected and dry mouth. After switching her to sugar-free choices, and she told her doctor that she had a dry mouth, her dentist noticed a slowdown in new cavities within about 6 months. Now check it out yourself at home, make a sip of water, and notice how the water feels in your mouth. Is it comfortable and natural to be soaking wet, or is it as if the water is just sitting on you? The next time you're visiting your doctor and dentist, be sure to share if your mouth has the sensation of being dry, sticky, or if you have too little saliva. Today, however, David's story got us to think of something quite different that's connected to a different part of the body you would have never guessed to examine if you had tooth trouble. I'm about to blow your mind, so bear with me and I'll explain it to you as I learn it myself from my own patients. This is a fact most people don't hear from anybody. Your jawbone is bone, like your hip or spine. Just like those bones, it can suffer the osteoporosis of bone density that increases after menopause and with age. There was one patient, Carol, 71, who I can remember had been taking care of her osteoporosis for years under her doctor's care. She approached me because she had noticed that the 2 bottom teeth in her mouth were beginning to loosen a little, not drastically, but enough that they felt different in her mouth. A check of the x-ray revealed that the bone beneath those teeth had become thin, just like any other bone in the rest of the body. That doesn't necessarily mean a person has to lose their teeth if they have osteoporosis. The same things that help maintain good bone health, getting adequate calcium and vitamin D, weight-bearing activity, and staying up to date with your doctor about your bone health also help preserve the bone that keeps your teeth in place. Carol's dentist and her doctor collaborated, and her bone health monitoring has expanded to include the health of her jaw. I was most impressed by the disconnect between Carol's 2 doctors' worlds prior to her visit. Her doctor had been monitoring hip and back bone density every couple years. Her dentist was keeping an eye on her teeth. One was missing and the other was missing until we combined both of them. I now recommend that all osteoporosis patients make a special note to their dentist that they have osteoporosis and ask their doctor if there are any osteoporosis medications that also have a relationship to dental work, as some do. And their dentist should know before any extractions or implant procedures. I remember another patient, Margaret, 76, who would just chew on one side of her mouth during family meals. There he was, silent for a time, he noticed. Of course, it was a tooth on her less strong side that was uncomfortable, and she'd tolerated it without saying anything about it for months. Upon obtaining her into the house, we were able to identify early bone loss there, which her doctor was able to remedy along with her other osteoporosis treatment. This is a theme that you'll be hearing throughout this video. Sometimes we notice changes first from our family because they see us at a holiday dinner, on the phone, in a picture. In our everyday life, we don't. If a member of your family has been in a non-threatening way hinting about your eating, chewing, or smiling habits lately, I'd suggest you not dismiss it as unimportant. They tend to be sensitive to something that is actually happening. To this point, here's the common thread. Gum disease, dry mouth, and bone density all erode away at the same support structure, the foundation that keeps teeth in place. But there is one more which I promised you at the beginning, and it's the one on which, in my experience, you overlook the most. The next one's not directly to do with your teeth. It's not about something people usually think of at the dentist office, it's at the gym. However, it may be the one most overlooked tool to help protect your teeth after 50. Before going into this, I want to show you a little bit of the puzzle, but it's a smaller piece because everything that follows is based on this. Did you catch that one? There's a two-way street between blood sugar and gum health. High blood sugar increases the risk of gum infection and slows their healing, and gum infection makes it difficult to control blood sugar. It actually goes both ways. I think of Frank, 67, who had been copping with type 2 diabetes for nearly 10 years. He arrived because, after several months, his gums were increasingly swollen and tender, although his brushing routine hadn't changed much. We healed the gum inflammation itself, and at his next physician appointment, his blood sugar levels were slightly improved. Not dramatically so, but enough that his doctor noticed and asked him what had changed. His daughter, who has long been concerned about his well-being, told me after, this was the first time in years that she ever heard him speak of going to a health appointment with anything but fear. That is the reason why I do this work. That's not only about the teeth. It's about the impact of a minor, manageable issue in one area of the body that can spread outwards and impact someone's perception of the overall health picture, their energy, and their confidence going into a doctor's office. So the easy-to-say message here is that for those with diabetes or pre-diabetes, tackling gum disease isn't really separate from a management strategy for diabetes. It's one of those strategies. Maintaining a healthy blood sugar is important in keeping your gums protected. One of the most obvious examples in the entire medical field of the mouth not being a separate system, but rather a connected system. Now, the one I've been working towards for all this time, Carol and Margaret mentioned, the one that encapsulates all of the chewing and independence and quality of life that we briefly touched on. Don't leave me out of this, because this is something that every senior misses. Bone and ligaments that surround your teeth are used like muscles and respond to use. As people begin to avoid foods that irritate the tooth, or dentures that are ill-fitting, or just easier to handle soft food, over time, such decreased chewing activity can lead to even more bone and tissue changes around the teeth. After just one uncomfortable dental visit, I think of Walter, 79, who told me he had switched to soup, mashed potatoes, and soft bread over the course of about 2 years. He didn't even realize he'd done it. It happened so gradually. His family had noticed long before he did. At a holiday dinner, his daughter said, "I can't remember when I'd last seen you eating an apple." His case, it was a broken filling, and with proper treatment from his dentist, Walter could reintroduce harder foods gradually. After he told me later that eating normally feels like getting a piece of his independence back. That's what it's all about. More than just teeth, it's about the confidence to eat what you want, smile for pictures with your grandkids, and not think twice about it. I don't want to be rude, but I'm not saying you should push through the pain. That's a different issue that you need to look at. If you're noticing that you've been hiding whole groups of foods, such as raw veggies, fruit with skin, chewy foods, or anything crusty, and you think you should look into why, instead of simply going with it, this is what I'm saying. That one little dietary change is one of the most obvious early indicators in my experience that something dental may need to be addressed, and it's likely that it's happening well before the pain starts to show. What's often overlooked is the social aspect of eating. One of the joys of this stage of life is being able to enjoy simple things such as a meal with the grandchildren, going out for dinner with old friends, and enjoying a holiday dinner without having to think about what you can or can't bite into. I've had patients that have withdrawn from social meals completely without saying why they are not eating it, and that can have an impact on mood and family interaction that they are not aware of. When you take care of your teeth, you are taking care of yourself and your loved ones in a very real sense. Let me dispense with a myth I hear all the time. Far too many of my patients feel their dental issues are solved once they get a denture, partial denture, or full denture. That's not the case and can cause real issues. Whether natural teeth have been present or not, gums, underlying jawbones, and soft tissues in the mouth undergo constant changes throughout life. A well-fitting denture may become loose or uneven over time due to the shifting of that underlying structure. And if a denture does not fit correctly, it can lead to sore spots and make chewing difficult, and in some instances, lead to more serious tissue irritation if it is not cared for. Teresa, now 81, was one of my patients who had not needed to have her dentures adjusted in the same pair for nearly 12 years. She had simply become accustomed to little aches and pains from time to time, believing it was simply the way dentures were supposed to be. So when she came in for an unrelated reason, they were no longer fitting well enough in her gums, so they got a routine check and she was relined and adjusted, and after they were relined and adjusted properly, she told me she didn't know what eating felt like for years, and now it did. So let's just correct that myth once and for all. Dentures are not a finish line. Like natural teeth, they must also be checked regularly to ensure a good fit, underlying tissue, and overall oral health are still healthy. And so now we've reached that factor which I promised you at the outset of this video that I think is the most overlooked by almost everyone and is the most important of them all. That's what it is. Most cases of tooth loss after 50th birthday are not due to one bad event. It's due to the time between dental appointments. Here's what I mean. A dentist has a range of teeth conditions that they can usually diagnose first before you even notice, such as gum disease, dry mouth related decay, bone density changes, and blood sugar connections, etc. Many, however, in this age group have a set of dentures or believe they have settled their teeth and begin having a checkup every few years. When a problem is detected by the patient, it may be far advanced. I think of Linda, the first one from this video with a little bit of bloody. Her story is a happy one simply because she spoke about it and we caught it early, started a deeper cleaning process, and now she has a 4-month checkup with her dentist rather than a yearly checkup. She still has all her teeth that she had at the first visit. That's compared to a patient I think about a lot, Harold, a 77-year-old man who hadn't visited a dentist for nearly 9 years. He didn't have any pain, so in his mind, there was just nothing to test. At the time we saw him, he had several areas of advanced gum disease and already had some teeth that had lost the bone underneath that were lost for good. Harold, since I told him this after, told me that if someone had told him all those years back that there was no need to be in pain, there was a problem, he would have come in a lot sooner. This is why I made this video, because of that conversation. That one thing that I want you to get from this entire video, and that one thing is to make sure you have regular dental checkups, even if nothing is wrong. Not a special toothpaste, not a popular assistance supplement. Twice yearly or more frequently, as recommended by your dentist, regular routine checkups. So let's keep it simple and practical. What I tell my own patients and what I would tell my own parents if they were watching this video right now, regularly go to the dentist even if there is no pain, even if he has dentures, even if it feels fine. This is usually twice a year unless your dentist advises more frequent checkups. Let them know of all medications you take, such as blood pressure, depression, or allergy medications, as dry mouth could be a sign of other issues and should be taken care of at an early stage. If your hair is sensitive or bleeding, don't ignore it. It is a small thing. It is usually not nothing and is almost always more easily treated when it is early. Discuss bone health with your doctor and include your dentist in the discussion if you have osteoporosis. If you have diabetes or pre-diabetes, let your dentist know because the condition of your gums and your blood sugar level are closely interconnected. Do not stealth any food. Avoid diet changes and social changes around chewing problems. It's better to get it checked. Drink plenty of water during the day, particularly if you are taking medications that cause dry mouth. Inquire about sugar-free remedies for dry mouth. Properly fitted dentures require adjustment visits, even if the adjustment is not observed, so the adjustments need to be maintained. Today's message for you. Tooth loss after 50 is common, but in the overwhelming majority of the cases I've seen, it is preventable. The symptoms are subtle but present. Some bleeding, some sensitivity, some other bite, some subtle changes in appetite. There's no need to worry about anything. All you have to do is pay attention and continue to show up for your checks, even when you have no symptoms. I am often reminded of Linda, Robert, David, Carol, Margaret, Frank, Walter, Teresa, and Harold. All of their stories are different, but the lesson that is the same under all of them is that the people who detected problems early maintained their independence, their confidence at dinner time, and their smile in family pictures. The waiters often wish in retrospect that they hadn't waited. If this video resonated with you and you think of someone you know in your life, a parent, spouse, friend, a child, please share this with them. Sometimes those who are in need of this information are the same ones who wouldn't even think of looking for it. If you're looking for a health expert that can give you more truthful and down-to-earth advice that is geared towards this phase of life, you'll want to give this channel a follow. Be safe, and I'll catch up with you in the next.